طيب نيجي الآن ل another type of anxiety disorders which is obsessive compulsive disorder و it is abbreviated as OCD وخلص يعني from now on بدي أحكي OCD لأنه standard abbreviation. What is OCD? Is recurrent obsessions or compulsions that are severe enough to be time consuming or to cause marked distress or significant impairment. طيب المعنى العربي أو هذا المرض يسمى باضطراب الوسواس القهري. ففي عنا كلمتين، الوسواس والقهري. الأوبسيشنز اللي هي الوسواس أو الوساوس اللي بتيجي للشخص، والكومبالجنز هي الكونسيكونسز of these obsessions. obsessions هي thoughts, ideas or images، والcompulsions هي behavior that are responses for the obsessions or thoughts that come to your mind. It is severe enough to be time consuming وبالتالي social functioning, occupational functioning will be impaired among OCD patients. Okay, or to cause marked distress or significant impairment. Let's look at this picture. Usually OCD patients or people are perfectionist, idealistic. يعني بيكونوا مثاليين، دائما بيبحثوا عن إنه كل شيء يكون 100% perfect. like this person in the picture, you can see that the grass are cut and it looks great, but he is focusing on one grass. يعني بس شايف إنه في هذول لازم ينقصوا مع إنه الأغلب مقصوص. For us it is okay, but for OCD patient when he sees something that is not perfect, the level of anxiety will increase. So sometimes he feel compulsed، يعني مجبور أو مقهور إنه لازم يقوم يتصرف ويعدل الوضع. So we said it is obsessive compulsive. Obsessive are the thoughts, ideas, and compulsive or compulsion are the consequences or the behavior that caused as a response to the obsessions. So again, obsessions الوساوس, recurrent thoughts, impulses or images experienced as intrusive, inappropriate and caused marked anxiety. Example of the obsessions, examples of the thoughts, ideas, contamination. Okay, so في ناس عندهم obsession إنه everything is contaminated، وبالتالي consequence will be for contamination اللي هي excessive hand washing. Another example of obsessions, doubts, شكوك. So you will see people that they have doubts. Did I lock the door? So he will go back to check the door, not one time, but 10 times, 20 times, okay? He will check the gas, بشيك عجرة الغاز 10 times, 20 times. So you see it is time consuming and need things to have in a particular order. Some people with OCD, let's talk about clothes, الملابس. فممكن تلاقي إنه they order clothes according to color. Then they will order them again according to size or according to are the shirts separate and put the pants separate and like that. Aggressive or horrific impulses. So let's look at the picture at the top of the slide. شايفين هاي الصورة يعني and you can assess yourself whether you have OCD or not. When you look at this picture, how would you rate your level of anxiety from 0 to 10, where 0 is no anxiety and 10 is the highest level of anxiety? If you don't have OCD, maybe you will say 0, 1, or 2. But if you have OCD, you will say that this picture is very stressing and the level of anxiety is 10. And if I know where is the exact place, لو بعرف عن جد هذا المكان, I will go to make the line to be in order. فراح يحركها على أساس تكون مرتبة بالشكل الصحيح. Okay, let's continue. There are not excessive worries about real life problems. فحكينا يعني هي not excessive worries عن للمشاكل الحقيقية, هي مشاكل فقط خاصة بالOCD. The person recognizes that the obsessions are a product of his or her own mind. فبتلاقي عارف إنه يعني ال OCD is time consuming وتستهلك منه وقت كبير, لكن at the end he is unable to help himself or herself to solve the problem. So let's move to the second. At some point, the person has recognized that obsessions are or compulsions are excessive or unreasonable, and that they are time consuming. عشان هيك قلنا إنه this person will lose his friend, he will have problems in social functioning, he will lose his job or his position as a student. So occupational or academic functioning will be impaired. And we must know that they are not due to direct medical or substance use. What are the explanations behind OCD? بالنسبة لسيغموند فرويد, psychoanalytic theory, he said that clients with OCD have weak, underdeveloped egos. Their ego is unable to strike a balance between the head and the super ego. And here in OCD usually the super ego is the dominant, هو اللي بيكون مسيطر, لأنه بنعرف إنه السوبر ego هو المسؤول عن إيش being perfectionist and idealistic. كمان Freud said that aggressive impulses are channeled into thoughts and behaviors that prevent feelings of aggression from surfacing and producing intense anxiety fraught with guilt. بالنسبة لل learning theory, ال OCD is a conditioned response to a traumatic event. يعني ممكن يكون إنه هذا الشخص مثلا شاف خلينا نقول حالة explosion gas or fire because of gas explosion in his neighbor house, وبالتالي بعد ما شاف هذا الموقف صار عنده دائما doubts إنه I should check the gas and close it 10 times 20 times. People handle anxiety either with passive avoidance, healthy response. يعني أنت بالنسبة للشكوك maybe you will go and check the door once, twice, and then you will move on. But for OCD patients they cannot resist, ما بيقدروا يقاوموا. إذا ما عمل هيك the level of anxiety will build up and continue to increase until he go back again to the house and check the door. What are the biological aspects for OCD patients? Some people they showed possible abnormalities in basal ganglia and orbitofrontal cortex with OCD. Some people showed some EEG changes, and for the biochemical factors or neurotransmitter, possible decrease in serotonin. And if you remember from the biological implication chapter, we said that most OCD patients have low level of serotonin, and it is treated with selective serotonin reuptake inhibitors. Let's see this question. A newly admitted client diagnosed with OCD spends 1 hour packing and unpacking, folding and refolding personal belongings. What is likely the reason for this behavior? احنا حكينا انه بالنهاية هذا الشخص دائما لما بيعمل الكومبulsions الهدف الرئيسي منها to decrease level of anxiety. Nursing diagnosis for patients with OCD, we give them ineffective coping لأنه حكينا المفروض يكون عنده healthier way to deal with stressor. إذا أنت بتعتقد إنه في عندك contamination المفروض إنك تشغل حالك خلص، أو تقتنع إنه أنا مرة واحدة من الهاند واشنج كافي إنه to remove the contamination. ف they are using ineffective coping, especially since we know that they are time consuming. They spend 1 hour or 2 hours in this coping mechanism. Also ineffective role performance, because they will lose their role. حكينا they will lose their job because of these behaviors. They will lose maybe their status as being a husband or wife, يعني divorce, because they do not care about the children. Instead they spend 2 hours 3 hours in checking doors or in hand washing. Outcomes, the patient should be able to maintain anxiety at a manageable level without resorting to the use of ritualistic behavior. Demonstrate more adaptive, healthier coping strategies for dealing with anxiety rather than ritualistic behavior. وكلمة ritualistic هاي مهمة، يعني لما نسأل إنه شو يعني compulsion، التعريف المختصر لها ritualistic behavior اللي هو تقليدي. تقليدي مش معنى هذا تقليد، تقليدي المقصود فيه تكرار نفس التصرف بشكل كبير، يعني غسيل الأيدي 10 مرات، هذا this is ritualistic، تقليد، تكرار. طيب بالنسبة للنيرسينج intervention, we must help client determine situations that increase anxiety and result in ritualistic behavior، ونحاول إنه to avoid these situations. Give positive reinforcement for independent and non-ritualistic behavior. كل ما شفنا إنه when the patient start to decrease the number of ritualistic behavior, for example, he started to decrease hand washing from 10 times to 8 times. So we should reward him and encourage him that you are doing a great job. Initially give plenty of time for rituals. Don't be judgmental or verbalize disapproval. If the patient is newly admitted, بالبداية we can give him enough time to do this ritualistic behavior. يعني let the patient to do hand washing 10 times because this is his way to decrease the level of anxiety. But gradually start to decrease the allowed time for this behavior. Teach a client how to interrupt obsessions. نعلمه كيف إنه to avoid doing compulsions or even avoid the obsessions. So teach the patient thought stopping. علمه إنه بس تسمع أو تجيك هالأفكار مباشرة، يعني shout, say stop, or imagine a red traffic light or a stop sign coming to your face. Relaxation, distraction technique, physical exercise. خليه إيش spend more time in a healthier coping mechanism. The last disorder that we will talk about in this chapter is called post-traumatic stress disorder أو اضطراب ما بعد الصدمة. PTSD. PTSD is a reaction to an extreme trauma which is likely to cause pervasive distress to almost anyone, such as natural or man-made disasters. فقاعدين نحكي عن something really serious, something or a situation that will cause crisis، أزمة، مثل disasters، الكوارث، combat، الحروب، serious accidents، a car accident. مش زي ما حكينا عنه في بداية التسجيل مثلا إنه minor car accident، لا، هون we are talking about serious car accident that caused death or مثلا paralysis for one of the passengers. Witnessing the violent death of others، مثلا شاف حالة homicide or suicide. being the victim of torture, terrorism, rape, or other crimes. For all these situations, all these scenarios are really serious, and anyone who experienced or were exposed to these scenarios will develop PTSD. More than half of all individuals will experience a traumatic event in their life. لكن not everyone will develop PTSD. Less than 10% will develop PTSD. Some people are at higher risk and are more qualified to develop PTSD. We will talk about that in within minutes. The traumatic event is described as one that is outside the range of usual human experience. فحكينا إنه the usual coping mechanism that will help you to decrease or treat a mild level of anxiety will be not helpful in situations like these. PTSD is more common in women than in men. This is one of the factors that increase the risk for PTSD, which is the gender. طيب, what are the signs and symptoms of PTSD? One of the most common and the most important one is called flashback, re-experiencing the traumatic event. Now, let's imagine an American soldier who was in Vietnam. Now, whenever he see a movie about Vietnam, or if he go to a trip to Vietnam or hear any story about Vietnam, then uh, he will remember all the details وكأنه لايف فيديو بث مباشر مرة ثانية وكأنه رجع لنفس الحرب. فعشان هيك the level of stress, the level of anxiety will be very high. We call this concept flashback. A sustained high level of anxiety or arousal, intrusive recollections or nightmares, amnesia to certain aspect of the trauma, depression, and survivor's guilt. Survivor's guilt means that if a group of people, let's say 4 people in a car, and they had a car accident and all of them died except one person, this person will develop the survivor's guilt. He will start to blame himself, especially if he is the driver. He will say, why I am the only one who is alive? Why did not I help the other people in the car? فالسيرفايفرز جلت بتصير لما الشخص يكون عاش بينما أصدقائه أو زملائه ماتوا، فيبلش يلوم بحاله إنه إشمعنى أنا الوحيد اللي عشت، ليش ما أنا ساعدتهم. Anger and aggression relationship problems. بالنسبة للsymptoms may begin within the first 3 months after trauma, or they may be a delay of several months or even years. لكن حكينا بظهر مرة ثانية لما when the person hears about the same place or the same war. الآن صار في عنا يعني خلينا نقول بالنسخة الجديدة من ال DSM بال DSM-5 صار في إشي اسمه Acute Stress Disorder or ASD, very similar to PTSD in terms of precipitating traumatic events and symptomatology, لكن the only difference is due to the time limitation. فإذا هذا الشخص experienced the symptoms less than 1 month, فهون احنا بنسميه انه he is having ASD. If the symptoms last longer than 1 month, then the diagnosis will be changed to PTSD. طيب, we said earlier that 50% of the people will have a traumatic event in their life, but only 10% among them will develop PTSD. Why? Because there are certain factors. These factors are classified into three major groups. As you can see in the slide, they are colored in blue: the traumatic experience, the individual, and the recovery environment. الآن under the traumatic experience, severity and duration and exposure to death and location. The more the severe the traumatic event and the more the duration, هذا الشخص على الأغلب will more likely will develop PTSD. فخلينا let's compare two person. The first person was a victim of torture or kidnapping, اختطاف, for only 1 day or 2 days, while the second person was a victim of torture and kidnapping for 6 months or 7 months. Most likely the second person will develop PTSD while the first person will not. كمان whenever the traumatic event leads to or there was a death, على الأغلب this person will develop PTSD. يعني إذا شاف هذا الشخص gunshot مثلا أو suicide in front of him, he will develop PTSD. If there is a car accident without death, maybe there is no PTSD, but if there was one of the passengers died, so maybe you will develop PTSD. Also the location. If you will pass by the location on a daily basis or it is near to your home, then you will develop PTSD. But if you travel far away from this location, you will not develop PTSD in the future. The individual himself or herself also play a major role in developing PTSD or not. What coping resources do you have? Do you have healthy and enough coping resources or not? Also, the presence of psychopathology. Do you have another types of mental disorders or personality disorders that may increase the risk of PTSD? Demographics. كل ما كان الشخص يعني عنده certain demographic factors مثلا uneducated or female are at high risk مثلا for PTSD. The recovery environment. هل عندك enough social support to protect you and at the same time for you to speak with them and express your emotions, you will not develop PTSD. Attitudes of society regarding the experience. What people will think about you. Let's take an example of female being raped. female تعرضت لحالة اغتصاب. شو نظرة المجتمع إلها؟ هل راح يساعدوها ووقفوا بجنبها ولا راح يلوموها وينظروا لها نظرات مش كويسة؟ فهون على الأغلب هي راح تعاني من PTSD. طيب, what happened with your body that will lead you to develop PTSD? الآن في ناس بيحكوا يعني one of the theories إنه during the traumatic event, during war, during kidnapping, during violence, your body will release endorphin, which is your natural opioids. فبتظل نسبة الاندورفين high during the traumatic event. الآن when you go outside, when you are released, when you go to hospital or when the traumatic event stops, these opioid levels, the endorphin will start to decrease in your body. So maybe you will experience something called withdrawal symptoms, أعراض الانسحاب, as if you were addicted on these natural opioids, وكأنك كنت مدمن أثناء فترة التروماتيك ايفنت على هاي المواد. ولما اختفى هذا التروماتيك ايفنت، لما انتهى الحرب مثلا، بتبلش نسبة الاندورفين تقل في جسمك، فبتظهر عليك زي أعراض الانسحاب اللي هي حكينا اللي هي signs and symptoms of PTSD زي الفلاش باك والنايت ميرز والسليب disorders. Also, dysregulation of the opioid, glutamatergic, noradrenergic, serotonergic, and neuroendocrine pathways may also be involved in the pathophysiology of PTSD. Nursing diagnosis for patients with PTSD, we give them post-trauma syndrome and complicated grieving. Complicated grieving, remember إنه ممكن تكون real or perceived loss. From real such as death. Perceived loss إشي معنوي، ممكن يكون مثلا في حالات الريب إن الفيميل تشعر إنه في عندها loss مثلا للأونر أو الديجنيتي. The goals and the outcomes, we should acknowledge the trauma and the impact to his or her life, to demonstrate adaptive coping strategy, made realistic goals for the future, has worked through feelings of survivor's guilt, attends support groups of individuals recovering from similar traumatic experiences, verbalize desire to put trauma in the past and progress with his or her life. Nursing intervention for clients who experience PTSD, reassure safety, decrease maladaptive symptom, demonstration of more adaptive coping strategy, adaptive progression through the grieving process. Stay with the client during flashback or nightmare. Assign the same staff as possible and establish trust. لأنه على الأغلب these people will be having trust issues with people. Encourage verbalization about trauma when ready. يعني let the patient decide when he is ready to talk about the traumatic event. Discuss coping strategy and assess whether these coping strategies that the patient use are healthy or unhealthy. If they are unhealthy, try to teach him healthier coping mechanism. Assess the client's stage of grief and help him to go through all the stages. Assess self-destructive ideas or behaviors, because if this person is having, for example, survivor's guilt, maybe he is at higher risk for suicide. طيب بعدك في عنا كمان new addition to the DSM-5 disorder is called adjustment disorder. It is characterized by maladaptive reaction to an identifiable stressor or stressors that result in the development of clinically significant emotional or behavioral symptoms. Symptoms occur within 3 months of the stressor and last no longer than 6 months. من اسم هذا disorder بالعادة بيكون في عندهم maladjustment، يعني they are unable to adapt to new situation. مثلا شخص travel to a different city to joined a new school, new university, they always have adjustment problems. صعب إنه يتكيفوا مع الظروف الجديدة، هاي بالنسبة لهم تعتبر stressor. For patients with adjustment disorder, we give them diagnosis of complicated grieving, risk-prone health behaviors, and anxiety. Also, we have a disorder called body dysmorphic disorder. And body dysmorphic disorder, people have exaggerated belief that the body is deformed or defective in some specific way. يعني they think that, for example, they are not beautiful. They require cosmetic surgery for part of their body, for example, for nose or lips. Not just to be beautiful, to be more beautiful, but they think that people hate them because of the shape of this part of their body. If true defect is present, the person concerned is unrealistically exaggerated and grossly excessive. The end result إنه ممكن هذا الشخص يعمل multiple cosmetic surgery for the same organ or take multiple medication. Symptoms of depression and obsessive compulsive personality are common. So let's apply the obsessive compulsive part. Here, the obsession is about having a perfect body shape, or the obsession is that people hate me because of my body or my shape. The compulsive, which like we said, is the consequence, the behavior that caused by these thoughts. Most likely in this disorder, the body dysmorphic disorder will be in the shape of having cosmetic surgeries. Another disorder, anxiety disorder or stress related. Hoarding disorder, a persistent difficulty in discarding possessions اللي هي الممتلكات regardless of their value. You will see the person keep old stuff, keep unnecessary stuff such as bills, الفواتير القديمة, something that is not working in the last 10 or 20 years. So they will uh, keep all these things. In some cases, they will not have even a space in their house to sit or to sleep because of the stuff. بسبب الأغراض تلاقيها متراكمة ومعبية في البيت. Additionally, there can be a need for excessive acquiring of items. فممكن هذا الشخص تلاقيه بيشتري بكميات كبيرة. It is more often prevalent in men than women. A nursing diagnosis for body dysmorphic disorder is disturbed body image, and for hair pulling disorder we give them nursing diagnosis of ineffective impulse control. For the outcomes, we care about that the person to verbalize a realistic perception of his or her appearance and expresses feelings that reflect a positive body image. For body dysmorphic disorder. For hair pulling disorder, we need to, from the patient, to verbalize and demonstrate more adaptive coping strategies to deal with the stressful situation. Interventions related to body image disturbance help client to see his or her body image is distorted. Involve client in activities that reinforce positive sense of self, make referrals to support groups. Effective treatment modalities for anxiety disorders in general: individual psychotherapy, cognitive psychotherapy, and behavioral psychotherapy. Systemic desensitization, implosion or flooding therapy. The last two are very helpful and effective for phobias. Psychopharmacology, we will give patients anti-anxiety medication. So notice that most of the anti-anxiety medication ends with the suffix zepam, such as lorazepam, diazepam. And remember that most anti-anxiety medication increase the level of GABA, which is gamma aminobutyric acid. Finally, we have this question: what should the nurse plan to teach a client who is taking alprazolam 3 times a day? Options: there is a potential for dependence and tolerance. The importance of discontinuing Xanax immediately if addiction is suspected. That increased caffeine consumption can enhance the effectiveness of Xanax. That Xanax is not habit forming. طبعا جواب صحيح هو إنه Xanax is a benzodiazepine and has addictive properties. disorder is called hair pulling disorder, شد الشعر. It has another name, trichomania. Is defined as recurrent pulling out of one's own hair that result in noticeable hair loss, preceded by increasing tension and result in sense of release or gratification. يعني the more stress, the more hair pulling will occur. This order is not common but occurs more often in women than in men. Which is compulsions. I said earlier, compulsions is the consequence of obsessions. Compulsions are defined as repetitive ritualistic behaviors or thoughts, the purpose of which is to prevent or reduce anxiety that caused by obsessions. Okay, it is performed as a response to obsession. So for each scenario, you should know what is the obsession and what is the compulsion. Obsession is that there is contamination. The compulsion is excessive hand washing 10 times, 20 times. If the obsession is about doubts, shukuk, that did I lock the door or not, so the compulsion is to go back and check the door 10, 20 times. If the compulsion is about putting everything in a certain order and being perfectionist, the compulsion will be to rearrange things إنه يرتب هاي الأغراض بطريقة معينة. As an example, look at this picture of the pencils. Again, the same question, how would you rate your level of anxiety from 0 to 10, where 0 is highest level of anxiety, lowest level of anxiety, and 10 is the highest level of anxiety. If you have an OCD, you will say 10, I need to order these pencils بطريقة معينة، مثلا إنه تحط المحيات كلهم لجهة والطرف القلم لجهة ثانية، أو مثلا الأقلام المبرية لحال والمش مبري لحال. كمان examples of compulsion praying. شو بكون الأوبسيشن هون؟ إنه did I pray right مثلا 3 ركعز or 4 ركعز، فبتلاقي this person will repeat prayers 10 times. Counting, some people have obsessions about numbers, so you will see a person who is taking the stairs يعني بيطلع الدرج، at the end he will say okay there are 40 stairs 40 درجة، فبتلاقيه مهووس بعد الدرج. Or repeating words silently, hand washing, like I said, checking doors. So all these are examples of OCD.